Hello, everyone, and welcome to today's webinar, Too Many Calls and Not Enough People. My name is Lou Delaprida, and I co-chair NERUCA's Education Committee, and I'll be your moderator today. So a couple of quick housekeeping items. Today's webinar is being recorded, and we invite you to submit questions either by using either the Q&A box or the chat. This is going to be a short webinar, around 30 to 35 minutes or so. And so for those of you who don't know, NERUCA is in its 10th year of existence, and today we provide grassroots local representation in partnership with UCA's National Strength. We tackle legislative issues at the state level, and we provide education and advocacy for urgent care medicine in the Northeast. We do this through programming, including today's webinar in our annual conference, which is our signature event of the year. Currently, we are planning our next conference, which as usual will be in the fall, and we hope to send the date out at some point in April. We're really shooting to try to get it out before the Urgent Care Conference. Speaking of April and the Urgent Care Conference, NERUCA will be at the conference, which will be in Las Vegas from April 13th to the 17th. You're all welcome to attend our chapter meeting, so be on the lookout for some more information on that in the next couple of weeks. Our next webinar will be on emergency preparedness, and it will be done in partnership with the New York City Department of Health. One webinar is slated to take place in late April, and the other one is at some point in May. Lastly, I'd like to thank our many sponsors for their continued support. Our sponsors currently include Xperity, Medline, Solve, Kidnum, Master Clinicians, and of course, today's presenter, TeleCloud. We recently updated our sponsoring packages, so you each should be receiving communication if you're a sponsor on that in the next couple of weeks. Those interested in sponsoring, exhibiting, or speaking should be receiving communication shortly. And then from you, if you're watching this webinar, we value your input very, very much. So if there's a topic that you feel we haven't covered, let us know. Shoot us an email at admin@neruca.org with any questions that you may have. So now it's my distinct pleasure to introduce you to Vin Finaldi and Brooke Dull of TeleCloud. Take it away, Vin.
Awesome. Thanks, Lou. I appreciate it. And for all those who signed on live, thank you. Our goal is simple. It's really to give you value. And if you're on this live webinar, or if you're watching this as a recording, we want to be informative, be educational, be a little lighthearted. And the subject of today's call is too many calls and not enough people. Anyone working in an urgent care facility probably can relate to that feeling where you get an influx of patients or an influx of phone calls, and it's like, who is going to handle all this? So we realized it's a problem in the industry, and our goal is to help alleviate some of it. So as we dive in, and by the way, Brooke on the webinar will be, if anyone wants to put a message in the chat or the Q&A, Brooke's gonna, for lack of better words, keep an eye on that, and then we'll address them as we go or at the end. But our goal is to be here for you guys. All right, so what's the agenda? I broke it down into 4 or 5 categories. Number 1, stop missing patient calls, and what that means. Number 2, abandoned call reports and automatic phone call recording and what it means to you. Number 3, effectively managing voicemails. Number 4, best-in-class auto attendant greetings. That's during the day and after hours and inclement weather. So our experience share on what that looks like when it's best in class. And we wanted to touch upon price to see if you're being overcharged by your current supplier or even undercharged and what that means. And of course, Q&A at the end or as we go. I'll leave that up to you as you're on the webinar. So on a personal note, I'm married with a wife, and we have 3 children, 5, 3.5, and 1.5. So as you can imagine, we've become very acquainted with urgent cares. It's like our third home, especially when you have a boy, girl. So this illustration is really to address what a lot of the patients are like. So you have the situation where you have a sick kid and you have a husband or wife at home that's stressed out. And a lot of the times they don't have either the headspace or the time to go open their laptop and go on the online portal to schedule. So in that scenario, that worried mother and father just goes on Google's local urgent care, and calls the number. My wife was even said she's done it multiple times because I talked to her before this presentation to get experience. So in that situation, so you have this urgent care, You spend all this money on opening up the urgent care, Google pay-per-clicks, Facebook, LinkedIn, possibly advertising locally with billboards or traditional other methods of marketing. So you spend all this time and money and resources on driving patients to your urgent care. And then when the call finally comes in, if that patient didn't go on the online portal, it's missed so often. And it breaks my heart as someone who's a business person, and for the patients who need care. So what we really do, when I say what we really do, what a good VoIP provider should do is help you with a system so you don't miss patient calls, and if you do, have an immediate rule or system in place that you can call back the patient. So I'm going to show you some of the software later in the presentation because I wanted to keep it more high level for now. But first and foremost, it's very critical to stop missing patient calls, especially if it's a first time patient calling in, to see if you're open and see what the wait time is to get some care, potentially for a child or potentially not. And then it's also important that when you have the front phone, so in an urgent care, usually you have 2 to 4 folks up front that answer the phones, handle the inbound, and then also greet the patients. It's also really important that the phones in the back that often don't get think about strategically, where they can act as an overflow. So if the patient does call or an important call comes in, and let's say the front desk employees are busy or tied up or in the bathroom or doing something, there is a backup plan where the phones can ring in the back and have it labeled for appointment scheduling. So if a PA or nurse practitioner or someone who's not normally answering the call, they could potentially be a backup in that situation. So I think it's really important to streamline communications and really think through the plan A, plan B, and plan C scenarios, which is what a good provider should be doing for you. So that was our first slide. As we get to the second, missed call notifications and automatic call recording. Again, I'm going to show us the software, but I just wanted to talk through it. So take the situation where a call is missed because you're understaffed or because the front desk worker is just unable to get it, or the backup phones no one picked up. So there's a reality. The phone call was missed. It's really critical to have a system that immediately notifies either the site administrator or the front desk folks or both that missed patient call, which can come in as an email real time or be managed through a portal. And you have a window of opportunity, usually not long because urgent is the key word here, where you might have a 5 to 20-minute window where if you do call back the patient, they still might be able to come to your urgent care facility if they haven't solved the problem or went somewhere else. So in that scenario, there's systems in place that can notify you of the missed call. And the second part is automatic call recording, which I think is so critical. We live in a world of compliance, HIPAA. We have to follow all these rules and procedures for proper patient care. And phone systems, whether it's us or any real provider, should be able to easily provide for you automatic call recording. That's any inbound, outbound call on certain extensions get recorded in the system, and that you as the site administrator or the owner can go retrieve it to get to the bottom of an issue or for training or for quality control. And it's really to get to the bottom of what was said. We jokingly, believe in the quote, trust but verify. Of course, everyone wants to do a good job. Of course, everyone wants to say the right thing, but sometimes things do go wrong in business or in urgent cares. And it's important, we believe, to go back and actually hear what was said between the patient and the clinicians or the urgent care. So I'll show you the actual software, but that was that slide. Voicemail jail. So this is something I could speak to personally. So I've spent in the last year, I personally live in Morristown, New Jersey. So a lot of our clients are in the tri-state area, which is part of the reason we thought NERUCA would be a good strategic partner. So a lot of the urgent cares we service are either in Connecticut, New York, PA, New Jersey, so the tri-state area. And what we find is when we go on site before they're a client, there's usually phones at the front desk with a blinky red light. And every time we look, there's like 10 voicemails or 20 or 30. And we'll ask the front desk, well, like, why do you have 30 messages? And half the time they don't even know the password to get in to check the voicemail. let alone a system in place to manage it. So we believe when it comes to voicemail, it's not a bad thing if it's used properly and thought through. So we'll dive into this when we show you the software as well, but leaving a voicemail is not a bad thing if it's properly managed and called back in a timely manner. Whether it's if it's a non-patient, then naturally you have a little more time to call someone back. But still, there's software in place to manage it. There's rules in place. So if someone's on vacation, someone else can get the voicemail. So voicemail jail, if you have a blinky button on your phone and no one's checked it at the front desk for weeks, it's probably a business problem that can be solved with your existing provider or with a new one. But it's something to just, not set it and forget it, in our humble opinion. Auto attendant greetings. When you think of Forrest Gump, you kind of think simple, right? And we believe that should also be an auto attendant greeting, whether someone calls in during business hours or after business hours, or inclement weather, or if you're inundated with patients and the wait time is 3 hours, you can you could shift the auto attendant greeting to be that, like, hi, we're, have very busy times. There'll be a 2-hour wait. So it's very easy with the right provider and service to make tweaks to auto attendant. And we believe the shorter, the better. This was a little, I think the volume will come through. So we did a little AI voice of just the sample of the speed and how simple an auto attendant could and should be.
Ethan, it's not playing on our end.
Oh, that was anticlimactic. I only heard it on my end. Thanks, Brooke. So too bad. It was a 8-second clip. That was, thank you for calling our urgent care. If you are an existing patient, press 1. If you're a new patient, press 2. If you're an existing provider, press 3. All other callers, press 0. The point was, it was short and sweet. I wasn't covering every basic on that auto attendant example, but the shorter, the better, and the faster, the better. I would encourage you, just after this webinar, go on your main number, go on Google yourself, call the main number and see how slow it is. A lot of times we found auto attendants could be 60 seconds or 90 seconds or have loops, and it's just wildly inefficient. And I get it. It's a set it and forget it thing that's done. You sign up with a provider 4 years ago, 3 years ago, 5 years ago. They do it once with the site admin and it's never talked about again. They're easy to change. And, I encourage you to do that. Thanks, Lou. If anyone has any questions, by all means, this is for you. We encourage you, put it in the chat or the Q&A. We're here for you, so questions are good. All right, are you overpaying? Are you overpaying, question mark, with the $sign. So let me touch base on fees when it comes to VoIP suppliers. I'm giving you more macro industry specific pricing, not our company. This is just purely educational on what we find. So number one is, are you being overcharged by your current supplier? I'll give a sample bill of a client we had being overcharged, but I whited out who the customer is and who the provider is. That's not important. But I'm going to show you a sample bill. And then I also talked about, are you paying too little? And I know that sounds kind of like you might roll your eyes like, oh, I'm paying too little. That's a good thing. Not necessarily. So in our experience, let me start with the first question. Are you being overcharged by your current supplier? So let me pull up a bill. It'll only take me a second and I'll share out the screen. So this is a customer of ours that has they have 4 locations, and this was their current supplier. This wasn't us. And we found what we looked at. So they're most urgent cares in our experience have between 6 to 10 phones per store or per location. And that's kind of the average. Of course, there's bigger ones, but we found the single roof urgent care is about 6 to 10 phones. And this customer was paying $329 a month for one site. But when you look at the fees, and the over trunkage of lines, there was some room for improvement here. So this client was overspending by about 15-20%. And when you multiply it across 4 sites, there's actually some money to be saved with a better solution. So I would encourage you to just look at your voice over IP provider bill, whoever you're paying for business phone service, and just look at it. And if you don't understand some of the fees, I encourage you to ask us or ask your provider, say, hey, what does this all mean? So these are some clever ways. So carrier cost recovery fee is a clever line item. Regulatory recovery surcharge. These are all surcharges and fees that really can be negotiated. They can be challenged. And this is the voice side. So the point is, look at the line item detail one time. I agree, it's exhausting to look at it all the time, and ask questions. The second thing is we found clients spending more than $30 a user per month. So if you take this total, 329, and divide it by the number of phones, which is 8. So if you take 329 and divide it by 8, I'm going to do it on my calculator right now. That's $41 per phone, all in. That's on the high side. So we found it's pretty reasonable to spend $30 per phone, including everything, which is hardware, services, software, support. So if you're spending more than $30 per phone, all in, you're paying on the high side. And if you're spending less than that, I'll give you the contrary. But anyway, this was just an example. If you look at your bill and you see tons of line items for a 6, 7, 8 phone account, it's a red flag. And it could be, there's some room for improvement. Let me go back to my, I didn't share my screen. Forgive me. That's the only downside of popping in and out of presentation mode. Hopefully it'll be quick. If I just click this, it'll look good for, okay. So that was an example of being overcharged. So to simplify the question, if you're paying $40 or more per phone, all in, that's on the high side. If you're spending $20 or less per phone, that's on the really low side. So if you have 8 to 10 phones and your bill's only $150 to $200 a month, it's usually a red flag there. And you might say, well, paying a little is great. Not necessarily. What you're probably experiencing is really poor or slow service, because you can't really provide great service to a client if they're underpaying, because you can't really staff up. The second thing, if you're paying too little, you're probably experiencing is there's no value. There's no one giving you education. There's no one training you. There's no one giving you best practices, helping you with call flows, because there's not enough money in it for them to really help you. And then the third thing you'll find if you're paying too little is there's no software tools. So VoIP phone service and technology, it's all software based. Call center, mobile apps, call recording, call reporting. So if you're paying too little, you're probably not getting much value. And as you could probably ask yourself that. So really, when it comes to the financial side of VoIP, the industry is very mature now. Most providers that are good charge about $25 to $30 a user all in, and they can give you everything you need. And we fall in that category as well. That gets us through. All right, with the 20-minute mark. So good. We stood true to our word. Q&A. So if any of the attendees have questions or anyone else, I'm here to answer some questions. Brooke, can you go into the chat? I think there is a question.
Let's see. Oops. Yes. What is the most common mistake urgent cares make when it comes to selecting business phone services?
The most common mistake I see is just making a decision because you could save 10%. So a lot of urgent cares and clients we work with, well, that we don't work with, they make a decision not knowing what a phone system can do. So most mistakes happen when you only think about the phones on the desk. Like, oh, we're getting 7 new phones, which is fine, and we save 10% a month, where the real value of a VoIP phone service is the software technology and the tools behind the software. While the phone hardware matters, as long as it works, it's actually the least important part of the solution, because IP phone hardware is all mature. They work. We're in 2024. Something should be reliable and just work. So the biggest mistake, in short, is not evaluating the software part of the purchase decision, only the financial and the hardware part. That's what I see. Anything else?
Yep. Let's see. If an urgent care wants to evaluate switching services, what is a practical next step for them?
So for an urgent care that wants to switch from whatever provider you're on to another, 3 steps. Number 1, find out if you're in contract with your current service provider. You'd email them, you'd say, hi, can I have a copy of my contract? Can I have, when is our contract end date? And if there are termination fees associated with switching. So the first thing you need to do is just find out where you are with your existing provider. The second thing, if you want to switch, reach out to the new provider and have them walk you through the process. What does your product look like? What does your service look like? What does your pricing look like? What makes you different? How do you help us onboard and switch out from the old to new? So it's important when evaluating VoIP service providers. It's not a difficult process. It would probably take 2 to 3 weeks to put it all together and plan. First thing is find out, are you in contract? Second thing is you evaluate the other providers, focus on the software side and the solutions they provide. And the third thing is to find out how they train you. Everyone knows you can get all this technology with Microsoft, with AI, with EMR systems. And if you don't know how to use it, or if you're not educated on what it does for you, it doesn't mean anything. So getting educated and onboarded and trained is just as critical as anything else. It's really the education to your staff of what am I doing with this new tool? That's critical. Those to me are the biggest talking points.
Alrighty, so you kind of answered the next question, which was how hard is it to switch? Does TeleCloud interface with EMRs was the next one.
Oh, copy. So a couple of larger EMR providers like Athena and Xperity. So the short answer is yes, TeleCloud is open sourced. So I'm just speaking on behalf of my company. Many other VoIP providers are also open sourced. So what that means is most phone providers, including us, can integrate with other EMR systems. It would be important for you, the end user customer, to ask your EMR provider, hi, we want to do some integrations with our phone system, like click to dial. So if you use the mouse and you dial over the contact patient number, the phone will ring. So that's called a click to dial application. And the second is called inbound screen pop. If the patient or vendor or provider, insurance provider calls your company, your EMR system can do what's called the screen pop, which is by reading the caller ID information. So the short answer is yes. It does require a little bit of alignment and coordination with your EMR provider, but integrating phone systems with EMRs is very, very popular in 2024, and it's a huge time saver. And yeah.
Great. And then can you show some of the tools for voicemail and missed calls, please?
Absolutely. Bear with me. Okay, so I'm going to switch to showing you a little bit of the software. Bear with me. So this is an example of end user software that clients have. This is just an example, so just take it with a grain of salt. So our urgent care customers, they really care about a few things. Number one is it's under the call center tab. And what that means is every call is tracked. So if this means 15 calls hit your urgent care today, 14 were handled. Abandoned is important. That means the call was missed. So 14 out of 15 is 6.7% abandon rate. It means one missed call in this case. And what's really great is then your site admin or owner or whoever at your facility can log in and see abandoned calls. And this is literally a call that was missed to your urgent care facility. And then this can also get emailed to the right people, whether it's the owner, the site admin, the front desk workers. So this is a real-time notification and reporting system for a missed call. That was something I thought was really important. Another one was earlier in the slide, we discussed voicemail and how it's really painful if you have 30 voicemails on a blinky button. It could all be managed here. So this is a voicemail tab, and this is the caller ID and the voicemail, and you could click and hear the WAV file of the voicemail. You could save it, forward it, cancel it. And it's really helpful especially for the front desk. And then multiple people can log in here. And if a voicemail is not checked within 24 hours or 4 hours, it could even send a notification to the site admin or someone, typically in the management level, that say, hey, this voicemail is unchecked. Really important for the front desk and the general mailbox. So the call center was important. The voicemail management is important. Something else I will show you is automatic call recording. So this is just an example. Let's say you have a situation where you have to find a past call recording for whatever reason. Bear with me. Here, I'll go inbound calls. So I'm just running a simple report, but this is a call log of all the calls that hit the phone system. And you'll notice if you scroll over here, you could see the recording. So if you hover over that, it says download. So this is a 4-minute conversation on February 28th. And you click that or that, and you can listen to the call recording or literally download it to your computer network. I'm sure you could save it in a file system. So this is really important, we found, for sensitive situations or training, or if you're unsure if someone your urgent care is trained up and you could check in on how they're doing on communication. So there's a lot of applications for that. So that was just a little bit of a little training. And the one last thing I wanted to show on the is what's also important, and this was bear with me, I'm going to jump one more time. So it's really about giving good patient care. So the real point of this isn't to be a big brother and to think your team isn't doing the right job. It's not that. It's to give the best patient care possible. So if you have new folks, the site admin or whoever the manager is can get access to that person's extension and then train them up. So they could just hover over and listen to their conversations and say, hey, you did great on this call. On this call, you could have improved here. So it's really about delivering good patient care. That's really what the call recordings do, which, as we all know, ongoing training education is key in business, no matter if you're in healthcare or any business in any industry. So that really is the point. And then something else I wanted to bring up was the mobile app. Brooke, do you have a picture of the mobile app on a PowerPoint at your fingertips? So I might just have to be communicative if we can't show it. So part of the phone system, I know it's multiple steps. There's phone hardware. There's some software tools I showed you about. Everyone in the world now has an iPhone or Droid. So what should be from your provider is a new mobile app, which is really important for doctors calling patients or any folks who work from home at times. You can make and receive calls using your iPhone, and it'll show your urgent care's caller ID, and everything will be logged and tracked in the corporate phone system. So it's really important to hide your personal information, especially if you could get text messages from patients or thank you. Perfect, Brooke. So this is something that is common amongst any VoIP provider, not just TeleCloud. This is standard feature set. So whoever provider you had, you should ask them about this. TeleCloud Pro, that's the name of our app. And what it does is you can now you could manage your business voicemails. You could see your missed calls. It mirrors your extension and your physical phone. And then if you do make an outbound call, it'll show your business caller ID of the urgent care. And then there's also an option to have text messaging enabled. So I know a lot of the EMR systems like Xperity, they do text notification updates with your patients, which is awesome. But if your EMR doesn't do it, we can give some basic text messaging capability when appropriate for certain people in the organization. Cool. Thanks, Brooke.
No problem.
And I think, let me just make sure. I think that kind of wraps it up. So let me kind of give you some tips to take home before we wrap this up. So high level, to reiterate kind of what I'd recommend to give you the most value with your existing service, or if you're looking for a new service, as you're evaluating, it's really important when you think of the telecom. Number one, the goal should be to not miss patient calls. And if you do, how do you capture the information and potentially call the patient back to capture the appointment and the revenue source, which is how urgent cares grow and stay in business. Number two, You'd want to know if there's software to track everything, call recordings, calls. It's called call queues, abandoned call reports, automatic phone call recording. That should all be tracked in the software system. Number 3, you should effectively manage voicemails through systems and software tools. Best-in-class auto attendant greetings. If you are, even now with whatever service you have, if it's long and crazy dated from COVID, when it has like a 3-minute COVID message, you want to think through shortening that even within your existing service. And number 4, are you being overcharged by your supplier? Check your invoice. See if there's a lot of line items. See if you're spending $40 or more per user, including taxes and fees. That means you're overpaying. If you're paying less than 20, you're probably underpaying, so you're not feeling product satisfaction or the service satisfaction because you're actually underpaying. Those are the best tips I can give you. And then the last one is phones are reusable amongst providers. So if you have physical phones on your desk, 9 out of 10 times you could reuse them if you switch providers. Not all the time, but most of the time. And that sums it up. I just, first off, want to say thank you. Hope you guys got value from this. We're going to send out the recording through NERUCA. We're going to, download it and send it out. And we appreciate everyone's time. Thanks again.